Great. So welcome to the webinar this afternoon, which is, I'll just admit one more person, sorry, my apologies. Engaging men in wellbeing at work. So thank you all for joining. It's a pleasure to see you all. A lot of you will be pleased to be back to work after half term, I guess. Okay, off we go. We'll start off with a few introductions. Thank you all for being here today. It's really appreciated. And hopefully we'll take some great learning away from today's session. Quick introduction. The person who's co-hosting the webinar with me today, my name is Paul Bannister. Can I just take an opportunity to introduce you to Emily Pearson? Emily, if you'd like to do an introduction.
Yes, good afternoon, everyone. It's lovely to see so many of you here today. My name's Emily Pearson. I'm the founder and managing director at Our Minds Work and one of the collaborators and partners of the ManBassador program.
Thank you, Emily. My name is Paul Bannister. I am the founder of Man Health. We've been working with men for 10 years now. Before that, I was a teacher. Before that, I founded the children's charity Heel and Toe. So a lot of work in the third sector, a lot of work trying to engage men in our peer support groups. But we also deliver health inequalities training across the United Kingdom and Europe to try and get the message across about men's health, because there is a real issue with men's health in this country, in fact, worldwide, and we need to do something about that. So, again, onto the presentation. We'll just get started with that and go straight through the next slide. Just bear with me 1 second. Some a few technical issues. Here we go. Okay, so the insights that we hope that you will all gain from today. You will learn who is the main at-risk group in your workforce. Okay. Emily will give you some fantastic top tips about how to engage your male colleagues. Great top tips from years of research that Emily's worked on over the years, and we use that to address all our programs. We'll also have a quick case study on the ManBassador program. And just to remind you all, you had an email before this event asking you to share any problems you were having with engaging men in the workforce. If you haven't done that already, please put that in the chat, and we'll have a question and answer session at the end to ensure that you can do that. Could I just ask, if you're not on mute already, could you go onto mute, just get some background noise there? Okay, thank you very much. Okay. So, who is the main at-risk group in your workforce? Okay, I'm just going to mute everybody. Okay. So, I'm hoping you've all answered the question that the main at-risk group in your workforce are your men. I'm sure you've brought all your challenges along with you. And we know from all the work that we've done and from all the people we spoke to in all the HR departments and the EDI people, how difficult it is to engage men in your organization. In fact, we spoke to an organization only last week, a major employer in the country. This employer had 104,000 men spread across the United Kingdom, including men who were really, really hard to reach because of the way they worked, and they worked mainly in rural areas, a lot of them as well. The average age of that workforce was 49 years of age, with an average length of service of 20 years. So as you can see, quite an aging workforce, which immediately would make them more susceptible to developing some of the conditions that I'm sure that you see in your workplace. So maybe it's time that and at the same time, this gentleman said he was finding it really, really hard to engage his male workforce. And that's quite typical with an aging workforce across the United Kingdom. So the men in our organisation only have a healthy life expectancy of 63 years. And that is lower in areas of social deprivation. So the life expectancy of men in the United Kingdom is about 78.9 years of age. But from the government website, a healthy life expectancy of all the men is only 63 years of age. Okay. And obviously with the retirement age now being 67, that's going to affect many, many organizations as the workforce continues to age. We also have an issue with 1 in 5 men. Apologies. 1 in 5 men dying before the age of 65. Okay. 75% of all premature deaths associated with heart disease are men. And men have a 40% greater risk of developing and dying from cancer. Okay, so there's a lot to think about there. And finally, the last stat, which you'll all know about, I guess, is that 75% of all lives lost to suicide are men. So why are we engulfed in this health crisis in the United Kingdom? Okay, and see some more insights that I'm going to share with you about the health crisis in the United Kingdom. Okay. The main reason the men in your workforce, okay, are an issue with engagement is because they have a lower awareness of risk, symptoms, treatments, and when to seek help. We call this a lack of health literacy. It's about people not having enough knowledge, understanding, skills, and confidence to use health information. It also means that they're not active partners in their care and they're unsure how to navigate the health system in this country. Okay. Men, as you will know, have little or no health education. What we find with men that we encounter, and we speak to men on a daily basis, is a real lack of knowledge when it comes to their bodies. Okay. And when you think about it as a man, for the men on the call, you will be able to acknowledge, unless one of these conditions has affected you, you probably knew very, very little about it. So, you know, and that's what we generally find. And men have had no health education. Even in school, we got no health education, no knowledge about our bodies. So they have a really lack health education. They also have no ongoing relationship with health professionals, and some of the stats we've got, I mean, this is startling. I find these stats startling now. 2% of men in the United Kingdom have never, ever visited their GP. And between the ages of 20 and 40 years of age, 50% less men visit the GP than do women. So lifestyle and work-life balance is another factor. We all know from the stats that men have poor general health than women, that poor diet, there's a lack of physical activity in men, and there's a lack of sleep. Okay, 67% of men in this country are classed as obese, and men, as we know, adopt gendered coping strategies to the problems that they're faced in life. Okay, and which could result in increased alcohol or increased drug use to mask the problems that they are facing. Okay, we also know that men tend to minimize the symptoms that they're encountering. Again, that's possibly down to a lack of knowledge, would possibly be because of stigma, and possibly because many men have been conditioned to be stoic and adopt the stiff upper lip. So the 40% more men dying from cancer is usually because the men present much later with these conditions. And we certainly see that in our peer support groups. We are getting men coming to our groups when they're already in crisis. We'd much prefer to catch them further upstream so we can help them deal with their problems before it gets to the point of crisis. And finally, personal and structural barriers. I've already touched on the fact that stigma is still a huge factor for men. They feel, both in workplaces and both visiting our peer support groups, that to admit that they need support, to admit that they're unwell, is a weakness. And they have the perception that admitting that they are unwell, they're either going to be laughed at, or they're going to be it's going to affect their employment at work and their types of promotion. So that stigma still exists. Okay. Another huge problem, which again many of us would cover, not just men, there's a real problem accessing frontline services. I mean, in the area we live, it could be 3 or 4 weeks before you get a GP appointment, and that's down to the lack of capacity in the NHS. We're also encountering the strikes by the junior doctors at the moment. So, and usually if men ring up to get a doctor's appointment and they can't get one, from our experience, they will very unlikely to try again. They're not very persistent when it comes to booking healthcare appointments. And also, from our experience and the work that we've done with many, many organizations, and you'll be able to tell us at the end, no doubt, that there's a real lack of awareness and uptake in in-house employment assistance programs. Again, recently had many conversations with organizations, and organizations are really pushing the employment assistance programs. They have apps on the phones, and many, many men don't even realize that they have access to GP appointments through work. So I'm now going to hand you over to Emily, who is going to talk you through 5 top tips on how to engage your male colleagues.
Thanks, Paul. I think it's been very, very clear just on some of those statistics there that we have a number of our male colleagues out there in workforces at the moment who are at higher risk of dying from one of the 5 biggest killers. And one of the biggest problems that we're also finding is, how do we actually engage our male workers? We know that there's an issue there. We've got health and wellbeing strategies and initiatives in place, but for many organisations, they're still seeing a lack of engagement from the male colleagues. And thanks to Nissan, Andy, for just telling us what has been working there in terms of physical well-being, looking at gym memberships. Physical well-being, is absolutely brilliant for those guys who pay attention to physical well-being. But what about the guys in the workforce who physical well-being isn't actually a thing, and they're not in that pre-contemplation stage where they're looking to move into improving their physical well-being as well? So how do we think about the guys where putting on a gym membership might not actually engage them? Hopefully we can talk about that today. But one of the biggest issues as well is that stigma and shame that comes along from saying that you have a mental health problem. So 5 top tips, and these came from 18 months of research that we did preparing us for the ManBassador programme. What we found through research from the Centre of Male Psychology, and especially from the Samaritans, we need to engage men way before crisis if we truly want to tackle these really stark and frightening statistics that are killing our men at a much higher rate than the killing women. And as a woman who has a husband, who has a father, who has a lot of male friendships in my life, I absolutely want my male friends and colleagues to be around just as long as I am. So let's go and count down from our 5 top tips, starting at number 5. I think we're having a few technical problems today, so thank you for your patience with us. Top tip number 5 is about evaluating your current initiatives. So if you already have initiatives in place, it's really important that we evaluate them and we ask your male workers to avoid any assumptions about their needs. Their voice is going to be really important for us to be able to understand whether these initiatives are relevant for them, whether it's getting out to them. Do they know about them? Do they think they're too feminized? They don't want to come and sit and talk about their feelings, but are more engaged in maybe it's a five-a-side football game. And we aren't going to know until we evaluate them and we ask the guys on the ground about what it is that would be engaging for them. So when we're thinking about your current mental health and wellbeing strategy, are you accounting for the health inequalities that men already experience? I think we're very, very good at shouting about women's inequalities, and absolutely rightly so, but men also experience health inequalities as well. And some of those barriers and risks Paul already talked about. So how can we look at mitigating some of those barriers for them? So for example, my husband, HGV driver, he works away Monday to Friday. So how does he get a doctor's appointment if he needs to speak to a GP during the week? You know, obviously having access to a GP through your healthcare provider could be a brilliant way of helping your male workers to access GP appointments when they need them, instead of coming up against some of the barriers that Paul discussed just at the start there. When you're campaigning, you know, when we've got a whole 12 months where we can run campaigns about mental health and well-being, there are major campaigns around men's health, especially where we have Men's Health Week coming up in June. You know, we're here to help you to prepare for that. And we've got a whole month of November as well in November time. But there are other campaigns that you may be raising awareness around as part of your health and well-being, mental health and well-being strategy. You know, how do you make them gender specific? So, for example, we have Eating Disorders Awareness Week coming up in March time. How can you make Eating Disorders Awareness Week really gender specific for the men who may be struggling with eating disorders? And that is a reality, as well as lots of information out there to show that mental health and well-being is just the same as when it comes to females and males experiencing mental health problems. When we're counting down from number 4 to number 4, so we're evaluating the initiatives that we've got in place, we're asking your male colleagues what it is that they want and if they aren't feeling engaged by what you already have. The next thing we need to do is build a culture of trust and psychological safety. What we find is initiatives will not be utilised if there is no trust and psychological safety. And we see this often as with a question around, well, we have, you know, all these mental health first aiders, but nobody's using them. And especially our male colleagues may not be using them. This is often down to a lack of trust and visibility. You know, as you're sat there today, you will probably know that if you were ever struggling, who would you talk to? It would probably be somebody that you trusted to not share that information, to keep it confidential and to respond to you in the right way. And when it comes to building trust and psychological safety in the workplace, what we found through our research with men, we asked 300 men where they found support when they were struggling with their mental health. The top 3 answers were their partner, their friends, and their family members. They were the first 3 people they would speak to before they spoke to anybody in the workplace. The next person in the workplace was their manager. Their manager is more likely to have a good relationship with their team members way before a mental health first aider would be. But what we also found through this research is that trust and relationships are very, very important to men. And men build trust in relationships very, very differently to women. Women build trust in relationships through sharing and talking. We'll share intimate details about ourselves, and this helps us to build trust. Whereas for many men, the research comes that building trust is done through shoulder-to-shoulder activities where we can build physical camaraderie. So paying attention to that when it comes to the workplace, how are you promoting positive male role models in your workplace? If you are looking at engaging men in your strategies, do you have a male sponsor specifically for men's health initiatives who sat right at the top, who can be that positive male role model at a senior level? We know that managers play a pivotal role in culture in workplaces. And what we also found through our research was that when we asked 300 men what had been the biggest contributor for poor mental health and well-being for them. Work-related stress was the #1 reason that they were negatively impacted when it came to their mental health and well-being at work. So developing your managers with the knowledge, skills, confidence to prevent work-related stress and be more supportive within their teams is, again, absolutely paramount if we want to support men in the workplace when it comes to mental health and well-being. And as we know, we need buy-in at all levels of the organisation and a commitment to improving men's health and looking at it in a little bit of a different way. So what we found through doing the ManBassador programme, there are certain ways that we need to engage men. And our tip #3, it covers that in exact terms. We need to use male-friendly activities. And the reason for that is what we were finding through the research of mental health and well-being activities in workplaces up until now is they're either very generic, given a one-size-fits-all approach, or are often feminized, which then leaves your male workers feeling absolutely disengaged from those activities because it just doesn't feel as if it's for them. So use initiatives that are specifically targeted at men. So if you think about our audience, if our audience are your male workers, you know, how do we market our initiatives and design them specifically to target your male workers? We've had some great examples there already about using shoulder-to-shoulder goal-orientated activities that encourage natural conversations once you've got the guys there. But it's the activity that's going to get the hook and engagement in the first place. If you don't have them engaged, we can't talk about mental health and well-being. We can't tackle stigma and discrimination. So ultimately, your activities are the most important thing that needs to be created to be male-friendly. Using activities that harness male camaraderie, really get some good engagement. And when we talk about our ManBassador effect soon, you'll hear about how ManBassadors have been using these male camaraderie, shoulder-to-shoulder activities to engage their male workforce. And they've been having a huge impact from doing that as well. So once you have you guys there, you can then embed education about men's health into activities. So once you've got them there, we can talk about prostate cancer. We can remind them of the occupational health provider. We can talk about ManBassadors that you may have in place on mental health advocates and champions. So with that engagement piece, it means that we can really start to open the conversation and provide an education around men's health as well. What we also found through a lot of the research was that many men wanted access to online information and signposting so that they were able to access this information when they needed it. But one of the main points about this is we can't just drop and leave it. We have to have repetitive messages about that information being there. So down to top tip #2. Once we've got our male-friendly activities going on, we've got some engagement, we've got our senior leadership team, we've asked the guys what they want, and we're actually putting that in place. We need to then be flexible and accessible. One of the things that came through quite strongly in the research is that guys don't want it to be super serious, so we'll come along and talk about depression. They wanted a sense of fun when engaging in these activities and your campaigns as well. So you've seen this time and time again with the Movember, creating silly fun tashes, but the seriousness of the message behind it is what we get across. The conversation starter and the activity of growing the tashes is how we get the engagement. What we also found in the evidence from the research was that men also enjoy competition. So we've seen some brilliant examples of ManBassadors holding competitions within their workplaces. Nothing to do with mental health and well-being, little even down to gaming, not even physical, little game and FIFA competitions. Bit of fun, bit of competition there. Get the guys engaged in that, but then take it to where your male workers are. And as we know, this is sometimes one of the biggest barriers, is that male workers may need to attend activities that are way out of where they would be doing their day-to-day work, and they're not given the time to actually attend them as well. So this is why it's so important to have that senior leadership buy-in and sponsorship, so that you get the go-ahead to take it to your male workers and give them the time that they need to be included in your health and wellbeing strategies. It's really important to make sure that we're communicating very, very practical information, it's accessible and it's welcoming. And do think about offering male workers the opportunity to fulfill parental responsibilities and attend medical appointments and workplace initiatives through that senior leadership buy-in as well. It's really about tackling those barriers and removing them where possible. And our top tip number one, once we've done all of those, this is it, we've got the guys engaged now. What we'll start to see is that word of mouth will spread, and you'll see more men time after time coming along and engaging in your activities. So we'll have to keep it going. This isn't just a Men's Health Week. It's not just a Movember thing. Every day should be about improving men's health and well-being together. But when you are engaging in your activities, evaluate the impact. Yeah, we need to continue to make improvements. Ask guys more about what else can we do to get you engaged in health and well-being initiatives. Listen to them and then take action. We've got to embed those initiatives and promote ongoing engagement. So making sure that a men's health agenda is embedded into your mental health and well-being. So you can even look at, you know, how do we have a man's guide to menopause? How do we look at, you know, eating disorders and how they impact men? So we don't just have to wait until the men's health initiatives. We can actually embed men's health into your whole of your mental health and well-being strategy. What we found is that embedded male peer-to-peer support is essential for improving men's health, because this is what gets the engagement. It makes it relevant, it gets it on the ground, and the strength of male peer-to-peer support means that they're able to have really sensitive conversations with male colleagues who are actually building trust through activities and that camaraderie together. So there are our 5 top tips. Hopefully they've answered some of your questions so far. And I think I'm handing back over to Paul at this point.
Thank you, Emily. We're just now going to talk about our Starbucks moment, Emily, and introduce the ManBassador effect after that. So if you want to just set the scene a little bit, that would be great.
Wonderful. So this is our Starbucks moment, which happened, oh gosh, probably about 3 years ago now. 3 years ago, Paul and I were having one of our regular catch-ups in our local Starbucks over a cup of coffee. And Paul, as usual, if you've ever seen him kicking around, he's not hard to miss because he always has his Man Health merchandise on. The Man Health van was outside and Paul had his Man Health t-shirt on. And we were just sat having a cup of coffee and trying to find ways to bring our minds work and the Man Health project together. We really wanted to do something amazing in workplaces to improve men's health, but we could just never figure out what it was that workplaces needed until this moment that was really pivotal and where the ManBassador program was born. We were sat just chatting, and a gentleman came over to Paul and said to Paul, "Are you Paul from Man Health?" Paul answered yes, and from here, this is Paul's story.
So the gentleman came up to me. I didn't know who he was, but it transpires that he would work at an organisation that we've been working with. In fact, we delivered our 4Bs, our health intervention for men, across the 300 men in the organisation. And he said to me, "I just want to thank you." And I said, "Oh, thank you. What is it?" He said, "I came to your session, and the following day I went to see my GP because I had a few concerns about some of the things you mentioned in the session. And a few weeks later, after having various tests, it transpired that I had prostate cancer and had to go on to have his prostate removed." And he said to both Emily and I just want to thank you because that session that you delivered that day undoubtedly saved my life." So as you can imagine, Emily and I were in bits at that point, but it just made us more determined than ever to really have more impact on the men in your organizations, because if we can save one life by them health interventions, we can save thousands and thousands of men's lives. So that's where the ManBassador program was born from that point onwards. And we just want to tell you a little bit about the ManBassador program now, if we will. Well, the ManBassador program is an accredited course that we offer. It's a level 3 course. And what we do is we will train men in your organization who are passionate about their colleagues and passionate about raising awareness of men's health. And the aim of the ManBassador program is to empower a proactive and preventative, that's the key, proactive and preventative approach towards improving the health of the men in your workforce. We need, like Emily said in some of her top tips, we need some men who are on the ground. I can't be there doing interventions all the time, and there's only one of me. We need ManBassadors throughout the country, throughout the organizations, who are giving these messages out and encouraging men to adopt great health and help-seeking behavior. So these advocates, these trained advocates that we've trained in your workplace, will be championing key messages consistently. Men need that. Men need to be told again and again and again when it comes to their health. One-off interventions, they have a place, they are fantastic. But from my experience, and I'm sure from Emily's experience, most men, if they haven't been directly affected by something, they will have no knowledge whatsoever. So the ManBassador program allows us to embed these advocates in your workforce. They are giving these messages out all the time, getting the men to adopt good health and help-seeking behaviors. They are raising awareness about the 5 biggest killers. They're also raising awareness throughout the year on other health campaigns. They are sharing relatable stories. We encourage anyone who becomes a ManBassador to share their lived experience. We'll train them into sharing lived experience. They'll know all about stigma and how to tackle stigma, and they'll also be skilled in suicide intervention. So they'll be providing a confidential listening and signposting service. At this point, Emily, would you like to add anything else?
No, I think it's probably a great time now to go over to just a little bit, a few examples of what the ManBassador program does, showing you what the ManBassador programs get up to, and then we can come to some Q&As.
We will, and we're going to start with a video from one of our ManBassadors, and I'll just put you straight into that video.
Hi guys, just thought I'd drop in a short video just to say how things have been going since I've done the ManBassador course. I think it's been about 6 months now. I was asked if I wanted to be a ManBassador for the site here at James Jones. I was a wee bit unsure at the time, unsure of what a ManBassador actually was. So I done a wee bit of research on the website, on the Man Health website, and decided to go on the 2-day course, which was very informative, very friendly atmosphere. Quite enjoyed the course. I was a wee bit sceptical on how people would want to reach out or open up. So I kind of went round the site, introduced myself more to the guys, having a wee bit more understanding on how to deal with certain situations with somebody. I mean, I've suffered with mental health problems in the past myself, so I had that background. But the ManBassador course definitely helped me reach out more to people. And I've had 5 or 6 guys that have had more than the one time come up to me. I've had 2 guys. One guy was pretty much hitting rock bottom. He's turned his life around. He's doing different things with his life now. There was another guy, he had a lot of family problems going on at the time. Again, him and his partner have turned things round just by speaking, getting a bit of advice from outside the family circle, and being signposted in the right direction. And signposting was something that was kind of drilled into us in the ManBassador course, and I think it's helped loads. And I always said to myself when I done the ManBassador course that if I could just help one person, that the course was a success for me. And well, it's definitely turned 2 people's life around. And like I said, there's 5 or 6 guys that have come up to me now, and I keep in touch with the rest of them, so they know that I'm here to speak to. But the ManBassador course is definitely worthwhile, especially with all the way men like to hide from their problems. But I can't speak highly enough of the ManBassador program, and Man Health as a group has been fantastic. So I'd just like to say thanks, and definitely recommend your services to anybody that's looking into helping their workforce. It's been great. Keep it up, lads. Cheers.
So that was an example from Steve Stewart, who's the ManBassador at James Jones.
Hi guys.
I'll just pause that. Sorry, but the as well as Stephen works in the Lockerbie site for James Jones. We delivered the ManBassador training at the Durham site of James Jones, and the guys have also, since the ManBassador was programmed, you've had what would you call if they organised a 5-a-side football tournament between the Lockerbie branch and the Durham branch, and I think they have a trophy every year, and I think the trophy was taken home to Scotland. But the guys get lots of great camaraderie and trust was built through that, and they've also, I think they went axe throwing on another occasion as well. So really building that camaraderie and trust. And lots of great conversations I know went on during that event. Another example of great work that's been going on we want to talk about is an organisation that we've worked with, is Tracerco. Tracerco men, fantastic set of ManBassadors. One of them pictured here with his ManBassador top on. In November last year, they decided to go for the worst mustaches, start the best conversation. And that was to support Movember. So everybody got on that and called it Tracermo. So they all grew the mustaches. And we've got some fantastic photographs of the mustaches. We've been told not to show them because some of them were that bad. But then again, it's a great way to break down barriers, to build camaraderie, a little bit of competition, and get men talking. So that's an example from Tracerco. And another example was Blackpool Council. It was another one of the customers. They were the inaugural organisation. They were back in November 2022. Who took on the ManBassador program, and Blackpool Council launched their ManBassador program. As you can see, Emily featured on that photograph there, and all the guys had a ManBassador t-shirt on, and they got a British champion down to the boxing gym. I forget the chap's name now, but you can see the ManBassador banner in the background, and they all had great conversations, just learned some basic boxing skills. So that was an absolutely fantastic event in Blackpool Council. And Blackpool Council are hoping to continue rolling out the ManBassador program across the rest of their male workforce. So some exciting things happening there. So we asked you to share your biggest challenges in engaging your male colleagues in your health and wellbeing programs. So we're just going to pause for a second. I'm going to stop sharing, and then we'll go straight to answering them questions. Okay. I'll start the video. Okay. Right, here's the questions. We're going to go into the questions that you have. It's not too late. If anyone's got any questions, please put your questions in the chat. We've only got the last 3 minutes, so we'll go to some questions that we've already had. Let's have a look at some of the questions we've got already. Thanks, Paul. We got a question asked about multiple sites and how do you engage people on multiple sites, maybe for you or Emily. Emily, how do we engage people in multiple sites? Do you want to take a lead on that one?
Yeah, no problem at all. I think one of the things that we've come across with this question is many of our organisations that we work with are far-reaching across the UK and also into the global setting as well. So some of the amazing ways that ManBassadors have been doing this is they have two legs. They have two legs, which means they can move around. And what we also train them to do as part of the ManBassador program is what we call making every contact count and having an elevator pitch. So every time they have a conversation with somebody, the last 60 seconds before that conversation ends is about their elevator pitch about the ManBassador program. It is so important that the ManBassadors get out to those hardest to reach guys, especially the guys who are not sat at laptops, they don't have access to emails, and they're going to rely on that face-to-face talking about the ManBassador program, just as we saw Stephen there, you know, just one of the guys getting out there. He was introducing himself and he kept doing that, making sure that he became well known as the ManBassador. So, you know, technology doesn't always get us where the hardest to reach guys are. And they are sometimes more often than not the most at-risk guys as well, who won't have access to technology. So legs, they walk. ManBassadors, making every contact count every time they have conversations in some of those harder to reach sites. And just to continue it, just to keep it going as well. What we've also found works really well with the ManBassador branding is, as you've probably seen already, it's very black, it's very white with bright green branding on it. So then as posters that are put up around sites, they're very, very visible. So make it visible within your sites and the places that you may find harder to reach. Anything that you want to add on there, Paul?
No, that was great, Emily. Thank you. We just had someone come in the chat there saying we often struggle arranging an activity that combines male colleague in the office and home workers. However, inspirational talks from men for men with a common interest have worked well, especially with the same working background. So a really great activity there that would get engagement going if you can get the men to come along. Another question that was sent in to us earlier, which was getting men to open up to our mental health first aiders is always a challenge. So I'll try and take that one, Emily, if we possibly can.
Yeah.
If you've already got a team of mental health first aiders in your organisation, that's great, and there's a real value in that. They do a great job, but what we find is with mental health first aiders is it may well that the men will come to the mental health first aiders when they are in crisis. Okay, the difference between the mental health first aiders and the ManBassador program is we want to catch the men upstream. We want to catch them well before they get to crisis. And if they've got someone who they know, who they trust, who they've built camaraderie with them over the years or months, they're more likely to go to them with their issues much sooner. So that's a great thing. It's by us using these on-site role models who are adopting good health and help-seeking behaviour, you may find that you get more likelihood of men going to speak about their issues. Anything else you want to say on mental health first aiders, Emily?
No, I think the trust thing and visibility is key. But also when it comes to mental health first aid, you know, your mental health first aid role is very, very narrow. It's listening and signposting. Your mental health first aiders often aren't trained to run effective campaigns. They may not understand what it means to market and engage men in male-friendly activities as well. So again, mental health first aid, very, very generic. And it also focuses on mental ill health, where what we're trying to promote is good mental health, good physical well-being. And as we know, mental health and well-being comes hand in hand as well. So yeah, I would just say the key really is trust and visibility for any peer-to-peer service to work.
Another question that we've got sent in. was for ED&I, we need to ensure that we include all groups, sectors and genders. It's a question Emily and I get asked quite a lot. And but the ManBassador program, what we need to make you aware, and I'm sure Emily will add some more, is the ManBassador program, although it's targeted at men in your organization, the information that the ManBassadors give out is available to everybody. Everybody in your organization will have some connection to a man, whether it be a son, a brother, an uncle, you know, so the information is available to everybody that they give out. Although it's aimed at the men in your workforce. Anybody can take part in any of the ManBassador activities, and ManBassadors might organize a walk, which is a very common thing to do, and that would be open to all colleagues in the organization as well. Anything else, Emily?
Yeah, I think one of the questions we also get is, can our female colleagues become ManBassadors? So the answer to that is no, and I'll tell you why. Because the ManBassador program, it's an equitable approach to men's health at work, because the 5 biggest killers disproportionately impact men. And what we know so far is that the health and wellbeing initiatives that are already out there are not engaging men. They're not relevant for them. So this leaves them not included in current mental health and wellbeing initiatives. So with the ManBassador program, it's about leveling up the playing field for workplace mental health and wellbeing initiatives, so that it's relevant for men and it's targeted enough to engage your male workforce. Because if we don't, this leaves many of your male colleagues not receiving life-saving health interventions at work and not being included in your strategy. And what we found through the research as well, especially from the Centre of Male Psychology, was that for men to break down barriers for other men, especially where there's vulnerability, to help them access support, that means that we only want to use men as ManBassadors. That's just due to some of the really fragile topics that require tackling that male-specific stigma, which we know is one of the hardest things to do. We want it to be psychologically safe and delivered without any judgment for what the men are experiencing. So that's the reason why. But exactly what you've just said there, Paul, the ManBassador program is inclusive for everybody. We only use ManBassadors to make sure that we are making it relevant and engaging male workers, but anybody can use the knowledge, the information, and, you know, attend the activities as well.
Well, we're coming towards the end of this webinar. Thank you once again for attending. I hope you found it very, very informative. In the chat, I've put a link to the Man Health Training website, which is manhealthtraining.org.uk. If you wanted to make an inquiry about anything that's been discussed today, I've also put the email address in there, which is admin@manhealth.org.uk. So it just leaves me to say that we will be sending out any of the information that we've discussed today. We'll be emailing it out to you. We'll also be emailing a link to this video that's been recorded today. And if you have any questions about anything to do with engaging men, please reach out. We will try and help and answer any questions that you may have. We haven't got all the answers, but we have got a wealth of experience between Emily and myself. As I say, we've worked in this field for many years, and we work with men on a daily basis. And we do know the problems that you're facing, and you know, no doubt any problems that you are encountering, we have probably encountered them. So thank you very much for attending. Emily, do you want to say goodbye to everybody?
Yes, lovely to see you all. Hopefully we'll get to see you all again soon.
It's been an absolute pleasure. Bye now. Thank you all for attending. Bye-bye.